Wonderful. So I'm going to go ahead and take care of my phone now that I know that all my panelists are safe in here. And I'm going to start with a brief introduction for everyone to talk about what's going to be happening here this afternoon. So thank you all so very much for being here. My name is Denise Bowles, and I think and I am known as Bold Doula here in New York City. I am a donor certified birth doula for the past 6 years with 148 births of experience, and I also have a master's degree as a medical social worker. I've been asked to do this panel, and to be honest with you, in all transparency, there has been a little bit of an aura of energy around this event for me. And I think it might have been the impending situation of the pandemic that we're all in. But for whatever reason, which is very, very hard to jump in. But what I ended up doing here this morning, even into last night, I was waking up every hour on the hour. And I finally did some of the stuff that we've seen here on this wonderful virtual conference here as far as meditation and going within. And I decided to do that. So in doing so, I did this activity, and Shango came forward. I do practice Yoruba faith. Shango came forward and said, honor me. And Shango is the god of lightning and drumming and all that can possibly come forward. He is the blood, he is red, vibrancy, and that's what I want to carry on into this discussion here today. So I have put up here 12 different attributes starting with the letter S that we're going to talk about today to actually bring forward the state of Black birth here in America. Letter S. I'm very, very proud and to be able to do this. I feel spiritually guided in doing this. If you were sitting here at my table with me here in New York City, I live 29 floors up and I'm able to see the water, and I have all my stones around me. I have lapis lazuli, I have rose quartz, I have dumarite to help me speak, I have carnelian, which helps me think, and I have golden healer. And this is all the things that we need to keep in mind with ourselves with this work. I also have black tourmaline because this discussion today is going to be a little difficult. I want it to be difficult. I want it to trigger you. I am not going to be doing this type of discussion today that's going to be about platitudes and throwing out a ton of statistics. I am right now in the best company of the most knowledgeable people when it comes to what's happening with Black women in America. We all know, we've seen gazillions and trillions of studies that someone else has made money off of. We look at the news every day. Something is happening to Black people. So I'm not going to sit here and pontiff those things to you. What I want to do is, with my panelists, I want to bring forward what we are about to get into. This is a new decade. This is a new era. This is a new way of communicating. The coronavirus has brought about a lot of different things for us. This is no accident. We are facing a major shift, and I want to bring this shift into our conversation today. Like I said, it will not be pleasant. It will not be kumbaya, but I'm really looking forward to the transparency. And I'm not here to stump anyone. I'm not here to embarrass anyone, but I'm here to get to the transparency of what is necessary, because the platitudes are no longer working. I would also like to say really briefly that I'm very, very grateful that a dear friend of mine, Nubia Earth Martin, has been able to join us on such short notice as another Black midwife, because one of our other panelists unfortunately could not attend because she had to take care of her family with the pandemic. And with it being the year of the midwife, I wanted to have as many Black midwives join this call as possible today, because we need to see them. And that is part of the S's attributes that we're going to be dealing with here today. So there will be, I will be looking as much as I can on the chat to see if you have any questions or concerns. I do want the panelists to jump in and be as engaging as possible. You know, politeness is great, but right now we can't really see each other to know who's going to be speaking first. So I don't want to lose time on trying to figure out who's speaking. So just jump in when you can and say whatever Spirit has guided you to say. Before we get started, I would like to take a moment to give some praise to my beloved ancestors and to all of the Black mothers who lost their lives giving birth, as well as to say a prayer of gratitude and hope for those who are experiencing the pandemic at this time. Thank you. So I'd like to get started with the attributes of S. I'm very excited, and I would like for my panelists to please come forward and identify yourselves, as well as your role when it comes to Black birth. Okay, so right now on my screen, I do see Pandora Hartman. Pandora, good morning, good afternoon rather, and welcome. Oh, I think did you unmute yourself, my love?
I'm unmuted.
Gotcha.
Can you hear me?
Yes, there you go.
Great. Technology. Well, thank you for the kind invitation to be with you all in this format today. It's exciting how we're being pushed forward into new times. My name is Pandora Hartman. I am a certified nurse midwife. 20 plus years later, it's kind of hard to believe. And I'm happy to be here with you today. My experience is kind of broad, you know. I have lots and lots of global experiences while I've worked in multiple continents and countries. And in addition, I've gotten several practices set up here in the United States of America in some of the major cities. You know, looking at Baltimore, I'm based in Atlanta right now, and my practice is always centered around women like myself, you know, who are immigrants, you know, to this country, and women of color. So thank you. Lots to say on this topic. I will say, just with the introduction, it's like, okay, this topic is so broad. Where do we even go with this one? We can attack it from so many different ways. So I'm looking forward to all your input as well.
Thank you. Thank you so much. Okay, Nubia. Nubia.
Yes. Greetings, everybody. My name is Nubia Earth Martin. I am a birth worker, been a childbirth educator, birth and postpartum doula, a lactation consultant, a birth worker trainer, and I have my master's degree in midwifery from SUNY Downstate here in Brooklyn, New York. I live in Yonkers, New York. And yeah, I have a lot to say on this topic as well. And I'm glad that we're having a conversation amongst people who are looking to see a change. I think we've heard a lot of the numbers. We know that we're dying. We know why we're dying, but what are the solutions? So I was grateful to wake up to your text this morning, Denise, asking me, and even more grateful that I was available this afternoon to jump on. So thank you.
Yes, yes. Dr. Brad, are you with us on the call?
He is logging on right now, so he'll be here in just a second.
Oh, okay, Jessie. Jessie, are you on the call, my love?
Yes, good morning. Thank you, Denise. My name is Jessie Reamer, and it's such an honor to be here in this process, in this significant weekend, because I got to sit with Tracy when this was an idea in her head. And so to see this incredible community coming together right now, this weekend, in this energy, it's really a privilege to be with you. I am a birth and postpartum doula with Donut International. I am a Lamaze trainer, and I've been doing this work. My first birth was when I was 7. I had all home births in my family. And then as I moved into a career of birth work in my early 20s, which was 25 years ago-ish, it's very quickly in that process, as I moved away kind of from the home birth into the hospital environment, I really started to see that birth justice, birth equity was really the top priority for my world and my life, and have slowly worked in the direction of working into larger systems. Here in Oregon, I am a part of the Oregon Doula Association in our statewide effort to create traditional healthcare worker models for all families to have access to good support. And I also work at a hospital that is specific for everyone to have easy access, free access to these services. So for me, I'm just excited to be here and support you and share in this conversation. Thank you.
Dr. Brad, were you able to log on?
He is trying right now. We're still getting him on.
Okay, okay. Okay, so once Dr. Brad gets on, please let me know so we can certainly have him. I've been a big fan, a long distance fan of Dr. Brad's for a long time. So I was just, biting at the bit to be able to speak with him and even get a selfie, but that'll be another time. I want to start off our conversation here today, the platform of talking about Black birth in America. And one of the things that has been blurred quite often, and many people simply are not aware of, is the impact of slavery when it comes to Black women and childbirth. And that's one of the S's for Shango today, slavery. It's not in the history books. You're not going to find this unless you take a specific class. You're not going to encounter this unless you encounter someone else who's woke to really talk about the gross national product of slavery in this country and how Black women's uteruses gave America the manpower to be one of the leading countries, one of the leading nations in the world. That happened because of Black women's uteruses and Black women's breast milk to feed this country before formula was even invented. Now, when we talk about slavery, people are like, yeah, and the racism thing, and people shut down. And when we talk about cultural sensitivity, it actually triggers people to be sensitive. So I want to move away from that also, because that's a phrase that's been overutilized to the point that it's just no longer effective. So what I want to talk about here with the panelists to start everybody off is the concept of slavery and how that is still present today. How are you all seeing the history of this country, over 400 years of oppression and some of the most degrading, horrific things against humanity, against our people, my people, your people, so for some of you, your people? How do you see slavery coming forward today with the Black woman when she's pregnant, when she's laboring, and when she's mothering? How do you see that?
This is an amazing one of my pet topics. And I swear at every birth, I try to use it as a teachable opportunity. I had 3 births last week. Here, I'm out of Atlanta Medical Center. It's in the old 4th Ward. That's kind of the area just down the street. We have where Martin Luther King preached and all of those things happened. So at all 3 births, one of the first comments that came out when the baby was delivered onto the chest was, "What color is it? Ooh, that baby's so dark. Ooh, that baby's so light." This, in my 20 plus years of career all over, this has not changed. And so then the parents are looking at the fingernails and looking at the ears and looking at the little toes. It hasn't changed. That is, and then the second reaction that often comes within, you try and encourage the skin to skin and the prolonged bonding is, from the grandmothers, a lot of times, "Put that baby down, you gonna spoil it. You gonna spoil it." So when we take this from a historical perspective, we see, and I've seen this from Baltimore to where I trained in California, it has not changed. That's still very much a part of it. And we think about slavery, the saying is light, bright, damn near white. It still seems to count, right? How dark is that baby gonna get? It seems to be, it's not after the baby cries, that seems to be one of the first concerns about the color. And then the impact of slavery, again, still felt, "Get that baby off of me, we're gonna spoil it." When we think about not just the maternal and infant mortality of the time, but the fact that women of color from the Caribbean right here to America, they faced a very real reality that that baby was going to be pulled for them, right? Baby was going to be sold, baby was going to be put on the side of the fields, subject to the animals. So I'm concerned and try to address that level of disconnect. Because, if we look at it from a psychological perspective, Erickson's stages of development, you can't spoil a newborn. You're only going to spoil somebody when they can interact with their world. So every time I'm teaching these stories at every single birth, no, you can't spoil, the baby needs to trust you, so forth and etc. So the impact, yes, ma'am, it is very real and still felt at the vast majority of births today. And if we don't begin to address that and talk about that, if we look again at breastfeeding rates, you know, our initiation has gone up, you know, in most communities of color. But when we looked at the prolonged breastfeeding, again, that's another issue as well. When we couldn't afford to feed our babies for so long because you were feeding someone else's baby or you were too busy with what was going on. All of these impact still today.
Thank you, Pandora. Thank you. Thank you. Anyone else would
I
like
just want to, yes. Yeah, so I just want to jump in and say, I don't start any talk about Black maternal health or birthing while being a person of color or a Black person without talking about the history of slavery and how that still impacts us to this day because we've never had an opportunity to heal from the atrocities of slavery and all of the mentalities that were placed on us and instilled in us, beaten into us. Those have not been lost. So yes, we're still going to have people who are lighter is better and, you know, all this because that slave mentality, that's plantation mentality, and we've never had a chance to address that. When we look at the history of slavery here, of course, during slavery, we were a commodity as a Black woman because if I was purchased for $300, but I give birth to 10 children, that's now 11 for the price of one. It wasn't until slavery was quote unquote abolished that all of a sudden we're no longer a commodity. Now it's a problem for us to procreate. So when we see all of the history of eugenics programs, forced sterilizations, sterilizations without consent, the idea that we can endure a certain amount of pain over other races, all of these things were perpetuated to kind of just further this myth that Black women can sustain anything. We don't need to have a place to feel, but also to stop us from procreating. So I hear what you're saying, Pandora, in terms of you still see people perpetuating these myths, but it was learned behavior. And that's going to be hard to break because we have not had the chance to properly address it or the chance to break from it. And when we look at our current maternal mortality morbidity rates, one of the main reasons that we are dying is heart conditions. That's our heart chakras. I know we had a chance to heal the generation after generation of trauma that we've dealt with. We have not had that chance to heal from that. And that is in our cellular DNA. So when you have problems with your heart chakra and you've never been able to deal and heal with that trauma or even address it or have a space to speak about it, it manifests as poor circulation. It manifests as heart issues, respiratory illness, anxiety, fear, and that is going to impact the way in which we give birth. And it's not normal to see, women in their 30s having cardiomyopathies and heart failure. But when you look at our history here, you understand the connection. So I think the conversation needs to start well before somebody is planning to have a baby. This needs to be, childhood level, that we explain to our children the history of where we came from, how this country was built, and what we're going to be up against in terms of people still having the mentality of Black women don't feel pain and Black women should not procreate.
Yes, Nubia, thank you so much for that. You may see me as we're doing this discussion today. I may get a little hot. I'm in menopause. I may cry. It depends. My ancestor table is less than 5 feet from my table now. So they are here in this conversation today. And I know I'm going to pick up some of their reactions with some of you with your beautiful testimony and saving space for this. This is what this is about. This is what we are. And saving that space and understanding our heritage, our lineage. Pandora brought up an excellent point. Look at my complexion. I'm one of the fair-skinned Black people. My family is biracial. Color struckness is a learned behavior. That is something that we look at. Rather than celebrate this life, we first have to look at it, because if it was not looking a certain way, there was a higher chance that baby would not be sold and it would stay with the mother. That's the inherent mentality that Black women had when it came to slavery and their children. They had to put their children down because they had to go work in the fields or they had to go take care of someone else's children. So in this country, when you see her, put that baby down. If you look at the nature shows, no other animal puts their baby aside except for human beings. Watch the nature shows. All those animals have their babies very, very close. We are the only ones who's going to put that baby down in another room, and we're going to be in another room. So that connection is very, very, very vital in Black life. And what I would love to see eventually, we're talking about studies, I would love to see a study on every person of color who's incarcerated in this country. I would love to know their birth background, because I can guarantee you that has contributed to why they're incarcerated. This legacy that we have in slavery has stretched well beyond. It goes into special ed, it goes into incarceration in the judicial system. And what Nubia said as far as heart disease, Erica Garner died postpartum from a cardiac diagnosis.
Yes.
And this was a woman who fought for justice and for the right of Black people all throughout her pregnancy. We absorb a lot of that energy, as both Pandora and Nubia have alluded to, and this energy is not safe. Racism is an abomination against humanity. And when we have to talk about it, when we have to diffuse it, that energy, as Nubia said, it fucks up your cells because it doesn't belong there. Sorry if I do cuss, I enjoy it, I'm sorry. So that's what happens with it. So that's what happens. So that's why this conversation is so very important. And that's why one of the other things we're going to talk about in the S's here today is self-care. We're going to get there in a minute. We got Shango is the god of thunder and lightning. He's the number 12. We're going to try to get through all 12 of the S's I've got ready for us today. We got 2 hours. And I know Brooke and I had an aside conversation because I was going to do an exercise of attributes with all of you. So Brooke, this is the replacement that came in my head. So we did something anyway, right? So let's stop for a minute if you all can bear with me. Dr. Brad was able to log in. He's here. Dr. Brad? Unmute yourself. Is he here?
He's here, but he's
Mute.
talking as well.
I'm here, I think. Hands? All right.
Hi, I'm your biggest fan.
I'm your biggest fan. How about that?
Dr. Brad, thank you so much for being here and bringing some testosterone to the discussion. This is going to be really good.
Everybody has to stop. Sorry.
So Dr. Brad, could you just tell everyone what it is that you do and how you are contributing to Black women when it comes to birth?
Hold on a second. My son just walked into the room. Say what, Chance? Just put him on the counter. Thank you. It's my wife's birthday today. So we're trying to organize
Birthday.
same time. All good. So what was your question again? I'm sorry.
What is it that you do in relation to Black women giving birth in America today?
Well, hopefully a little bit, but what I try to do is make sure, and I caught a tail bit of your conversation, Ms. Martin, and I agree, but I try to make sure that they maintain their voices. And in maintaining your voice, I think a lot of the things that people project onto us could either be dismissed, enhanced, embellished, or put into context. And I say that because if people view us as being stronger, can take pain more, maybe she's kidding, maybe she's not, don't take her seriously. If you can maintain your voice, you can contextualize what's coming at you. And so what I try to do is have mothers maintain their voice. And the best way to do that is to have a shared decision-making conversation that's balanced, that is not one of condescension or one of, I know something more than you, but to take them from where they are to maintain their voice. Because if you maintain your voice, you'll ask questions, you will say, holy, something is really going on here. You won't self-edit if you can maintain your voice. So in doing that, I think mothers can can be empowered, mainly.
Thank you, Dr. Brad. Thank you.
So hopefully that answers the question.
Yes, and empowerment is one of my favorite words. So that and talking with my hands, because I'm from New York.
Understood,
I'm gonna sit on
understood.
my hands right now. Okay, so Jesse, I don't want to leave you out. We're going to hop around as much as we can so that everyone has a chance to contribute. And you may want to pass and not have anything to say right at this moment, and that's completely understood.
Well, I'll never pass if I can share. We're all teachers that way. I think the thing that came forward for me right now, and this may be another S on your list, is space. So when I think of slavery, I think of the way in which Black women, Black birthers are asked to come into and accommodate their process in white spaces, and how that layover. It's like not creating space for the support systems around them to accommodate specifically your unique needs. So therefore, it's a process of already that's kind of self-editing, because the words I hear in our spaces are, this person's non-compliant. This person isn't taking advantage of what we're sharing and offering, partly because it's not a comfortable space. It's not a personalized space. It doesn't feel like a safe space. So I think that's the word that comes to mind when I think of slavery and how it permeates this environment. And I also think then too, it's also about seeing more providers and midwives and doctors that look like you. So it's that sense too of also having access to people that are going to be sharing your experience and that personalization component. So I feel like those are two places where some of our biggest injustices exist and how it's carried over. Because then if it's no shared experience, then how can we even start that conversation in the regimented environment of a hospital system? And I'll pause.
Thank you, panelists. Thank you. The next S on the list in relation to Black women and giving birth is safety. Now, with this pandemic that's out here, there's been a lot of shaming already, another S word, of women who are utilizing the hospital. Now we're hearing the rhetoric of, I bet you wish you had a home birth now. We have to keep in mind that not every woman is a candidate for a home birth. And we still are obligated to keep women safe in America. And I am all for a home birth. My grandmother was a midwife. She gave birth to 11 out of her 12 children at home. Okay? My mother didn't have a birth certificate. She had to apply to one because back then in the day, they just wrote your name on somebody's roster list and that was it. I'm not opposing home births. I think they're beautiful. I think they have their place. But in the context of how birth work is shifting, we cannot shame women, especially Black women, who are not coming forward as it is. We can't shame them when they're choosing a hospital birth instead of a home birth. That is not keeping Black women safe. The other paradigm on the other end of what I want to talk about here today is the level of education. Safety reflects the level of education that we all come into this as birth workers. And we're doing Black women a huge disservice when you have doulas out here who are saying, I'm not certified and I'm not going to get in the system and I'm not going to do this and I'm not going to take this training and I'm not going to do that. I'm just going to go in and support Black women and keep them safe from these hospitals and these clinicians and stuff. You're not understanding that this is a profession. And the lockout that's happening now with this pandemic emphasizes even more that without certification that phlebotomists have, respiratory therapists have, x-ray therapists have, radiation, all of them are certified. Doulas are certified entities also. And Black women deserve to have safety in a profession that is safe, that is accredited and is backed by ethics and by education. So when we talk about safety here, when it comes to Black birth, panelists, please contribute what you think is happening here with Black women in birth when it comes to safety.
If I can jump in. So education is paramount, right? I mean, I think that is the key piece that is missing for a lot of people. Some people don't know their options for where and how they can birth. They just, assume or are told or led toward a certain way of where they should birth and how they should birth. And I agree, home birth is not for everybody. I happen to attend home births with my midwifery partner. That's the care that we give. But I know that everybody who reaches out to us is not always a good candidate for home birth. We do know that home birth is the safer option for somebody experiencing a low-risk pregnancy. That does not necessarily mean that that is the best place for that individual to give birth just because they're low risk. In the same vein, with all of the coronavirus things that are happening, we've got an influx of people who are now afraid to go into hospital and are seeking home birth. And I also reiterate to them that I don't want you to make a decision based on fear. I want you to make a decision based on factual information so that you can determine where the best place is for you to give birth. So the education piece is so important because there should be no ego in this birth work. It's not about where I would want the majority of people to give birth or what I want my clients to do. This is really client-led care. And the only way that a client can make informed decisions is if we're giving them factual information. So yes, the doula needs to have their information. The midwife, the OBGYN, whomever is going to be part of her care needs to be informed, but also allow the person the space, and I'll say the sacred space, to be able to make the decision for what's best for her. That's how we keep, women safe.
Thank you. Anyone else on the panel, please?
Safety, it's really a huge issue. I see someone here put in the chat box about the finances, and whoever you are channeling my thoughts about this. Because when we look at birth safety, realizing that, the expenses of a birth, even in a client that may want a home birth, and for me, I've done it all from home birth to, giant university practices, that financial safety is something to actually be considered when women make that choice to go into the hospital, something for us to think about and to help also support them in their choices. The other, when I think about safety as well, what strikes for me too, again, it comes back to the education both with our healthcare workers. You can sometimes find a huge debate within the midwifery community about which path to go.
Yeah.
Whether you're all those variations, all the paths. But, for my choice, and when I do counsel those looking from a safe perspective to enter to the profession, I'm biased. I know I say, get your CNM, get your CM, because with that credential, you're safe. No matter what happens with any of the laws anywhere, you can do your home birth, you can do whatever, and you still can feed your family and not go to jail. Because the bottom line is, as a Black birth worker in some of the states that are not as open, to outside models, they're more at risk. So there's a safety, I think, in the health workers. For the health workers, there's a financial safety. And then also, if we go back to the education of safety, is being with our clients and with other care providers to also realize the impact of choice. Dr. Boots Taylor talked about giving voice, but for so many, it's about actually finding, in women who may have been in their lives, so giving them a safe place to find it, and then choice, action, consequence as well. And when we look at some of the things related to pain medication or any of those choices that could happen within different environments. So safety, it's a multi-pronged thing that really challenges us to think outside of the box of all these aspects.
Thank you. Thank you very much, Pandora. Anyone else?
I'd like to make a brief comment about safety. When you have, I guess, 100,000 accidental deaths occur in hospitals, it's hard to view hospitals safe in the United States. And then on the flip side of the coin, we're talking about maternal mortality in someone who's had a medicalized birth experience. It's hard to view that as safe. So safety becomes, I guess, relative, and it also depends on who is making the statement about safety. So I see the word used in various contexts to chaperone someone's choices. and to make them feel, well, this is the safest thing for you, mother, to come in and have an induction because I think you're 39 weeks and you need to have the baby because you might die. Well, it's probably another agenda in there. So I think moms have to literally take the power back to themselves to make some judgments based on risk tolerance, based on science, intuition, experience, friends and families, input, and things like that. So when someone hears the safest thing for you to do is to have a birth in the hospital, that person needs to be mindful enough to say, well, why is it safe? Why is it not safe? If I know a lot of people are dying in the hospital. So I think it's definitely a nice word. It's almost like saying it's a high-risk pregnancy, but then when you tease out the layers of what the risks are, you realize, oh, I'm just 36 years old, and that's it. So I think that if a mother can maintain their sense of the conversation is like, once again, use their voices, questions, and to contextualize what actually is safe or not, then that'll make it safe. Be it home, hospital, birth center.
Yeah. I'm also going to ask that if you're not speaking, can you please mute your mic, because your stuff is coming through and it's hard for the listeners to actually hear. I don't want anyone to miss anything. Did anyone else want to chime in on safety before we move on? Because we have another 10 attributes of S to get through, and I want to make sure we get through them all. I don't want this to be cut short today. Okay, the next attribute on here for S is service. And here's where the pet peeve comes in for me when it comes to Black birth. Service. Community-based doulas are inherently Black, Latina. They are not white. I don't know of a white community birth doula. I live here in New York City. I have yet to find a white community birth doula. Why do I say this? Because community birth doulas are inherently known to be paid less, to work for free. I just took part of an orientation for a training with a group of community doulas here in New York, a room full of Black and brown women. And one of the leaders who directs the program stood up and said, don't do this for the money, do this for the feeling. Feelings are not going to pay your electric bill, nor is it going to put food in your belly. So when it comes to service, why is it that when it's Black birth, service, community doulas, why are we all Black? And why are we expected to be paid not at all, or be paid at a very low scale? And how is that impacting birth? Because in talking to many doulas, what we found out is, yeah, you're getting that low cost. Oh, I want a doula in training. I want a low cost doula. When the shit hits the fan in the birth room and you only paid her $300, the more experienced doula that costs more, you ain't gonna get that support. So that $300 is gonna run out pretty quick. So, panelists, your thoughts. Service, Black birth.
So for myself, I realized that with home birth specifically, there is a big barrier to access in terms of someone being able to afford out-of-pocket expense. I also at the same time realized that if somebody really wants a home birth and feels that that's the best place for them, finances should never be the reason why they can't have that space. So one of the services that I offer as the nonprofit that I run, which is Births from the Earth, is I write grants specifically to allow for scholarships to offset the cost for home birth services. So that way you're not asking the midwives to, you know, take less and not be able to feed their family, but you're also not boxing somebody out from being able to have the birth that they feel they want to have in the environment that they feel they want to have it. We know that Medicaid covers significantly less for a home birth than it would for a hospital birth where all the fees will be covered, no questions asked. And many of the midwives that I speak to say that they don't take Medicaid clients for this reason. I have a problem with that because we know that many of the people, not all, but many of the people who are on Medicaid are Black and brown. We know that they are dying in hospitals and want to increase their chances of surviving birth. So if it comes down to money, I feel like it's a disservice for me to turn somebody away simply because they cannot afford an out-of-pocket expense, especially when there are enough people with private insurance or who can pay the full fee out of pocket where it would balance out. So I think that is part of the service that we have to do. I also feel that when we talk about community work and community birth work, yes, it is disproportionately Black and brown women who are asked to uphold the whole community, support, do all this work. And again, that's us not, that's also a kickback to plantation mentality where we did have to make something out of nothing. We did have to try to survive and band together. That was paramount to our survival. However, I think now we have to realize ways that we can also serve ourselves as we're serving our communities and be able to maintain our families, maintain our, our needs without sacrificing to the point where we're suffering. I know that was a lot of S's in there.
Anyone else on the panel?
This is Jessie. I feel like the systems, the ask for systems comes into play here. I know just from my own personal experience here in Oregon, one of the things that we're really looking at is the dichotomy, because we passed a Medicaid bill that would reimburse doulas, and they started off with a fee of $350 and then waited for like 3 years and realized nobody was participating. So I definitely think systems have to be created. And one of the things that we have started to do successfully here is we actually wrote, we worked and partnered with some researchers to evaluate the value of doulas in this area just on one marker, which was cesarean birth, and found that the use of a doula is valued at even just by reducing cesarean rates up to about $1,200. So that we've started to see that in the last year. We've now been able to partner with, we have specials like CCOs here that take kind of community-based monies, including Medicaid. And we're starting to see our community-based doula programs now being able to contract with them at rates of about $1,200 per doula, which in our area is kind of a more experienced doula range. So I have a glimmer of hope that we're starting to see some systems that actually will reflect and break down that, that old perception of you can just do it for free and this is how it will get done. Because when, we women in general and also Black women have been asked to do that for so long. And then now we see that if we're going to actually make an impact. So we have some eyes and some system changes that I think can be relevant. And I'm hoping, actually, because I know so many states are looking at this, that we can start doing some more national sharing of what could be working in different areas.
And if I can make a comment, I think sometimes the system, if you will, and the providers enable enable. So, and by that I mean that if mother doesn't feel she can be the one to be, mother doesn't feel she can be, and the doula get paid $3,000, then doulas getting paid $300 are going to be out there. Getting paid $300 be out there. But they have enough of a voice to look at what their preferences are to have a doula or not, have a hospital birth or not. Preferences are have a doula or not, have a hospital birth or not. The most impacted is waiting for the system and the providers to come and save her. Then you're not going to get the revolution that we're waiting for. Having said that, in this 21st century with technology and the ability to get a group of people to get angry over nothing with social media, the mother, the customer, needs to become more vested in changing the paradigm. To wait for people of color to service moms in the community, and hopefully they get it together and march to the Capitol and get bills changed and all that stuff. It's wonderful. But I think as long as the client, the customer, the patient, the mom feels that everyone else is going to do the work for them, then I think you're going to continue to have this conversation for years in the making. And there's no need to maintain that paradigm in this era of technology, where all of a sudden everyone can work from home and have a virtual meeting, in fact. If moms feel that they're gonna wait for the midwife, the doula, to rescue them, then I think that's gonna just continue to perpetuate the process. And I say all that to say that what I try to promote in mothers is shared decision-making, shared responsibility, and guided discovery. And when that happens at the ground level, then there will be a paradigm shift. There will be a revolution. And that's historic. I mean, if you look at things over time, you don't get voting rights waiting for someone to sign a bill. You don't get the right to vote waiting for someone else to do it. You got to get out there and demand it. And when moms start doing that, then you're going to get changes of the system and the providers. So.
Whoops, well, you know, Dr. Brad, thank you so much for saying that. And that also leads into a little quick thing I want to just also throw in here when it comes to service. Black doulas in general are promising a shitload of things in their practice, in their service to families. And a lot of it is out of their scope of practice. In order to keep this practice with the integrity and with the professionalism that it deserves, I'm asking for those who are participating on this panel discussion and listening today to really go back and take a good assessment of your doula practice, of your CLC practice, of your midwifery practice. Are you going into slowly becoming a social worker? Are you going into becoming a psychologist? Are you going into becoming a clinician? And that's not your scope of practice. We are practicing and we're providing service because, you know, we want to feel we can do all. And that will bring up another one of our S's in a couple of minutes of savior. We're going to talk about that in a couple of minutes also. I want to bring up here selection. And Dr. Brad, if I can remember correctly, and I'm not sure if this is 100% true, but from my exposure here in birth work, the president of ACOG was a Black man. Is that still true? Is he still Black? Is he still a president of ACOG?
That was Ezra Davison from UCLA Drew Medical Center. He's not the president.
Not any longer.
No.
Okay. Is there a person of color as the president of ACOG now?
Not to my knowledge, but.
Okay. Thank you. For the midwives here, now we know how contentious midwifery practice here is for Black women in America. Are there any Black women in positions of deanship, presidency, leadership in these American midwifery education models? Any of you can call out any names?
I cannot call out any names. I know Pat Loftman for a while was heading something with ACNM, the Midwives of Color Committee. I believe Felina Ortiz now has taken over that role. She is Latina. But I will just say in terms of the profession in America, it is 95% white and 5% other, not even 5% Black or brown, but 5% not white. So that is a big power struggle. And, you know, we've spoken on past panels. I've spoken with you, Denise, about the struggle to not get into a program, but to be able to complete a program and all the barriers that there are for becoming a midwife in America. And, you know, I'll say this, and I know some people will probably either be offended or whatever. We need to remove ourselves sometimes from being so reliant on the masses' past or papers. We do. That is also slave mentality. I'm saying it. I don't apologize about that. I feel that way, having gone through a whole master's degree program, having been through the hazing, the weathering, the unfair treatment, the being held back, all the things that I'm not even going to sit here and bring up all the trauma of that. But that needs to stop for the next generation of midwives who are attempting to provide the service, because we know we need more birth workers, midwives, doulas of color, because we have systemic racism, implicit and explicit biases. And when somebody is providing a service to somebody who not only looks like them, but who has had those biases be perpetuated on them, they are less likely to perpetuate them on somebody else. That is key to the care that we're going to be giving. So when you have a profession that is 95% white, are the majority of people out here who are looking for midwifery care going to be able to see a provider that looks like them and has, you know, cultural sympathy or whatever for them? No. But we are very caught up in, well, this paper says this, and that is, you know, that's being caught up in the masses past. That's what that is, you know. And so you have papers. Let me see your papers.
Yes.
It's not just about the paper. It's also about the experience. It's also about what you're bringing to the table. I'm not saying that obviously with laws and all this, that it's not validity, but it is not all. And that is what a lot of people attain to. We need to abolish plantation mentality.
Yes. I want to focus also on Jessie. Jessie and I have been friends for a long time. We are both affiliated and credentialed through Donor International. I am Black, of course, and Jessie is... What nationality are you, Jessie?
I'm white predominantly, but I do have my Mexican grandmother's side on my dad's side.
Well, and Jessie's white. And in Donor International, Jessie, you have the affiliation and the flexibility and the affluency of being a doula trainer, correct?
Yes.
How many doula trainers are there for Donor International who are Black? Do you know?
I would say, aren't we a handful compared? There are about 150 of us, right? And don't we have, what, 4 or 5?
Less than 1% of
Okay.
that are Black. And of course, some of them will recognize as Latina, if that. I'm being generous with that. And the reason why I'm not targeting you, Jessie, I'm here to make a point.
No, I understand.
Election is when we're talking about doula work. It's great having white people come in and train. Some of them are woke as fuck, and you get a good training. Others are not, and they're here just for the dollars and to make the training, don't make the connection with that potential doula and on to the next city to train. You have to question, you have to wonder why in 25 years of being in existence, organizations like DONA, DTI, Kappa, why is there such an absence of Black leadership, of Black women coming through as doula trainers? Last year, we had our first Black president for Donor International, and that went over pretty uneventful. There was no anything to bring out her ethnicity or to reach out to fellow Blacks. This year, we have a Native American who's the president of Donor International. And 2 years before that, we had an Afro-Brazilian. Did you know that? Did you know any of that? No, because as Nubia is saying, we're so programmed through slavery that we will get into these organizations and we will simply melt away our heritage, our culture, our ethnicity to fit in. Now,
Yes.
Tell me this now, Jessie. Have you stood up in the room when DONA has their conference? They always have a closed door doula training meeting. Y'all up in there fighting, crying, puking in corners, doing all kinds of shit. Do you stand up and say, "Hey guys, I think we should let some more Asians and Latinas and Blacks become doula trainers"? Have you decided to step up in your white entitlement and say, "Hey, this is so unbalanced. This is ridiculous"? What are you using your affluency for when it comes to selection of diversity in leadership?
Yes. So I would say, in terms of my own process, one of the things that for me started off just as a feeling of extreme discomfort with the whiteness of our organization over the last, I've been involved in DONA for 20 years. I've been a trainer for about 12. Was part of the process was peeling back my own personal journey, even living in the state of Oregon where the institutionalized and bias racism of a state in which we even allow Black people to move to our state until the late 1800s. So part of that was a very personal process for me. I would say my profound change was about 4 years ago when we actually had a moment where we brought the trainers together. We haven't had that opportunity for years until we finally started doing this with those closed door, like, let's get all the trainers together. And we had our first conversation about white supremacy. And for me, that was the very first moment when it was like, okay, I could start to really feel and realize the participation that I'd had in not even seeing the white spaces that we had created. And so, just to be totally transparent, even though my heart was in that space, like that's the place where I am. So it's really becoming like an apex for me as I've been doing the personal work of looking at my own silence for up until about the last 4 years. So in the last 2 or 3 years, I would say, as I've been really saying, okay, what can I do? Up until this point, I had been doing small things in my state as a trainer, where it's like I would always hold spaces in my classes. I would always have scholarships for women, but then that's not necessarily getting people from an entry level point to a trainer level, right? Getting, as we just discussed, getting people all the way through the process. So the first thing, really, this is actually kind of my coming out experience, where I made a commitment to myself last year that I would start to be a voice as a cisgendered white woman to create space for not only women of color to have that, and also start to use some of my own resources, whether that's small things, and this is not touting my role in any way, but being able to sponsor people to come to this conference, being able to step up and encourage mostly the white people around me to say, we have to look at this, we have to do this work, and building resources to create those conversations. That's the one thing I think the biggest thing I can do. Right now, I feel like I have the privilege right now and the honor of sitting with you to hear what's important for the Black community's voice from the Black community's voice. And now it's for my job to go to my white hospital and these other places and go back to DONA and start, and start saying, we have to do this work. It's not your job to do this work. It's the institutionalized process that we have to dismantle. And so, if I look at, if I look at these places, it's like committing to dismantling that part of the process is no longer separate from my birth work. And that, I feel like that's the place where I came to in the last 2 years, is there's no way to do this birth work unless I'm working on this aspect of birth justice. And that now becomes everything I do. It's in my mind in every aspect of where I'm walking, whether I'm working directly with a client or I'm starting to engage more at the international level with DONA. So I think that's a shocking experience for some. We actually had our first national regional meeting for DONA as an example. Here in Oregon, it was in Portland, and we had Nikia Lawson, who is one of our African-American trainers, and we have our local regional trainer, Talia Anderson, who's our representative, both African-American leaders in our community. And I got to lead a conversation basically with a group of 99% white doulas in the room, and to start even just with the simplest terms, like what does it mean to be an ally versus an accomplice? I think we live in a progressive white city which thinks, hey, we're all being allies here, but we're not taking action. And that's the place that I think needs to happen. It's, this is a basic human right. You can't believe in basic human rights for birth unless you look at what's happening to every single part of our community. So.
Oops, sorry. Nakia Lawson and quite a few doula trainers that are out here are absolutely phenomenal women who had to put in double the years that you've had to put in, Jesse, in order to get where you are. They had to come in based off of another scholarship that another woman of color fought for relentlessly until it was reluctantly given almost 15 years ago, and they haven't done it again ever since. It was a one-shot deal. So we have to understand the importance of that. We have to understand where that's coming from when it comes to Black birth work. Because I'm sure, Dr. Brad, you can tell us what it's like going through med school and being a man of color. I'm sure that, some white women won't even utilize your practice because you're a Black man and they fear you. So, those are the type of things that we have to understand when it comes to selection in Black birth work. What you see.
I can make a comment.
I'm sorry?
Sorry, can I make a brief comment?
Of course.
Yeah, and there are some people of color who won't come see me because I'm not white.
Right.
So the psychology of that, I'm sure we all can spend a day talking about that. Self-hate, self-loathing, et cetera, et cetera. So all that to say, go back to the Nakia Lawsons and your organization. As long as you are, and I'm going to sound like a broken record on this. As long as you're waiting for the system to change to appease something, it's probably not going to happen. When you have the client, customer, patient demanding more doulas of color, donor will train more. And so if people of color aren't aware of doulas to begin with, they're not going to ask for it. They're going to go to the other's practice and have a birth in Northside Hospital. That's here in Atlanta, the highest C-section rate in the country, by the way. They're going to go there not knowing about doulas, not knowing about DONA, not knowing about Nakia Lawson's or yourselves, or community-based midwives. So if the customer isn't asking for a doula of color who's certified to make it a safe space at home or hospital or birth center, then the four people on this conference call is not going to change that. And Jesse, I applaud you for saying what you said. I find it admirable, but you're one out of 150 and it's a board of 10 people. They're going to marginalize you, and at some point they're going to dismiss you from DONA because you're speaking up for cisgender. It's just, and I've seen that dance many, many times in my career. So if the mother/client is woke, if you will, I see the comments in the comment section. If she is woke enough to start using her voice to ask for that service, then the culture, the medical environment, DONA will change, or someone will create an alternative to DONA, like what you've done with NBDA. So it is that pressure from the ground level that will cause the board members on DONA to say, you know what? We got one person of color in the last 20 years. We need to change that inherently, be it for marketing purposes, how it looks to the general public, or maybe even from an economic perspective. But it's going to take that woke individual at the ground level who spends more time trying to decide what kind of iPhone they should get than deciding the impact of the people around them to support their birth.
Absolutely. Thank you, Dr. Brad. And that's why the National Black Doula Association is so important. And that's why the activities and the integrity of this organization has to be on a very high bar, because we are up against so many other entities that are waiting for us to come in on the low bar. I will say that. And I think that is so very, very important. And, like for an example, doula agencies, you sign up with the doula collective, the doula requests come in. you know, are these doulas who are brokering, are they asking, you know, these clients, would you prefer to have a Black doula? Would you prefer to have a Latina doula? Would you prefer to have a white? Those selections that Dr. Brad is talking about is very, very important. And, you know, not for nothing, I've had white clients tell me, Denise, I want you, the Black woman, because when the shit hits the fan, you're not gonna go in the corner and cry like some other ethnicities are prone to do. It's our makeup. Black women are strong. We don't have a choice, you know? So this whole selection process, whether it be med school, whether it be midwifery school, whether it be doula training, this selection process also impacts Black mothers giving birth because, well, there's a scarcity. And coming back to this pandemic and promoting home birth, we don't have enough Black doulas and Black midwives to support Black home birth in this country. There's a shortage. So before you jump up and say, oh, I bet you wish you had a home birth now, let's get the Black women or Black people trained to be OBs, midwives, and doulas so they can support when there's a pandemic. You know what I'm saying? So that's where that is. Now, we're talking about, you know, a selection. I still have the big beef, and if anyone has ever listened to my podcast, I'll say it again. We have two very large entities in this country that are underutilized: the Black church and the Black fraternities and sororities. I don't want to hear from any of them until they start sponsoring Black midwives going through midwifery school, Black doula trainings in their community, and Blacks going through med school. Now, the Black doctor organization that I happen to be a member of here in New York, they do have scholarships to help Blacks go through med school. Dr. Brad, I don't know if where you are or whatever Black Association of Physicians or obstetrics that you're associated with, I don't know if they have them, but they do offer scholarships. So these Black mega churches, take out 5,000 square feet and put that money on sponsoring a Black midwife to your community. Buffalo, New York has the only viable Medicaid program in New York State that it pays for doulas, and they do not have a Black midwife in Buffalo, New York. It's so fucking imbalanced.
Can I make a comment?
Yes, sir. I was about to cuss again.
Just to kind of decrease the expletives anyway. I appreciate the color and the flavor of that. I can't say this enough. The fraternities and the churches, there's no need to change unless the people at the ground level start to say, you know, midwifery, etc. You know, so I think it's interesting to say this service should be available, but you go through the training with Donna or through your organization or through Ms. Lawson. You want a doula at your home birth, but you're not willing to pay her more than $300. I mean, so the customer has to start pushing the envelope to make those organizations appeal to what that preference is. And it's easier to do now than ever in our history. Before, you had to take out an ad in the paper or go to a small meeting of 2 people after work at 5 o'clock, go to an organization, appeal to a church member. Now you can do your own thing, create your own little movement without even getting off your out of your kitchen table. So the energy to shift the paradigm and the tools are now there to do it has to come from the customer. It has to come from the client.
Okay. Yeah,
Because
we
who's
do
going
have
to go?
that power
Because
with Black dollars. We do have that power with Black dollars. Lord knows.
who's going to go through midwifery school and take on that debt only to have no one come to you?
Mm-hmm.
I kind of have to jump in at this point.
Yeah.
Of course. Because, you know, as I'm listening, and while I believe in grassroots movements, I also think very strongly that we are doing a disservice to our community because we don't get our heads out of the perineum. We need to look past the other P. For me, okay, after like a long time in clinical practice, I got pissed off. And that's actually what sent me back to school. I had no intention to go back to school, but it forced me to go back to school to get the doctorate, because you want to know what we're really missing is at the policy table. And that is where all the dollars and the cents and all the rest of it that is truly impacting change is happening. So yes, grassroots, but we have to be bottom up and top down. And I can say in the intervening years, I've been able to have much more of a major influence. Yes, I may be the only Black woman at that table in most cases, and I have to do deep breathing exercises, and I'm sniffing my oils everywhere. But yet, because we're there, that's where the money is. If we look at what's happening even politically here, last week, the Black Maternal Health Caucus, and there's a whole Momnibus, that set of bills that came up, that's looking at all these perinatal stuff. To be able to sit in the back and to be able to give feedback on some of the legal language and things like that. Because I had a concern when we were looking at some of the early drafts of that stuff, because they were all about just what we're saying here. Recruit more Black midwives, recruit more Black doctors, recruit more. And I'm like, recruit, then what the hell you gonna do with them? Because I know, having been adjunct faculty, that people then are recruited into these programs or these career pathways, and they're not retained into the system. They're not graduating from the system. But nobody wants to talk about that ugly elephant in the room. Get in all you like, but at the end of the day, if you can't pass your boards, it don't matter, because you're not serving your community, and then you've got, $100,000 worth of debt. So these are the issues, and you need to be able to sling a glass of wine in your stilettos just as much you can deal with your aromatherapy oils. So I think in addressing these problems, we also need to look at ourselves across the spectrum of everywhere and coming together. So I'm sorry, but
No,
that was some good stuff right there.
No, if I can make a comment to that, I totally agree with you 110%. Top and bottom.
Yes.
Stilettos, scrubs.
And twerking.
Well, gotcha. But I totally agree with Pandora, 110%. But when you are the only one in the room fighting for more of whatever, and then at the other end, like you said, there's no appeal to it, or no, I'm not going to thank you for fighting, but no, then you're literally left there holding the bag. So then it's like, well, let's not bring another one of you on the board. We got one, that was plenty. So it works both ways. It's kind of like you can't be at the forefront of you can't be the tip of the spear and no one's behind you.
Mm. Yeah, that spear's got to have a handle to make that hit. And that also leads to another conversation. Maybe next year I'll present on, God willing, on ethnocentrism in birth work. Because this whole thing about Blackness and having that one Black voice, which once again comes from slavery, where the master picked one Black person who was very likable from the plantation to speak for all Black people. You got these organizations, you got these faces in Black birth that don't represent everybody. But white people have been very lazy and say, oh, we'll tap her again. Let's interview her again. And the same person keeps speaking on Black birth, and it really doesn't represent Black birth. Not to mention there's some shady shit that have been going down too with that, but that's another presentation I can do. But you want to say something?
I just want to piggyback on all of your ideas and say that, yes, there's usually one or two that are chosen to represent the greater, voice of all Black people. Because again, slave mentality, if 2 or 3 or more were gathered, they think we're plotting. So there's that whole fear. So you're not gonna see, panels like this unless we create these panels ourselves. And we do need people at grassroots, top, everywhere in between. And, for ACNM last year, I spoke on a panel there at their annual conference about the need for more support of student midwives of color, not only just to get into programs, because all these programs boast diversity. Oh, we accept so many people into our program, but how many are graduating? That's never addressed. And what is the process like to even graduate? What is the process like with AMCB being the only accrediting body for CMs and CNMs? There's some shadiness going on there that we've yet to delve into. So I definitely believe that we need to hold these institutions accountable for sure, you know, keep the pressure on their necks, but there is something to be said for creating our own as well in the meantime. And we need people on all levels, and people need to know where their area of expertise is, where their voice can have the most impact. And sometimes that is at the very tippy top. Sometimes it is within the community. So there are many different ways that we can address this. And my big issue at ACNM last year was there was a committee meeting and there was a vote about how can we better support student midwives of color. And there was a motion put forth that for everybody who pays their very hefty annual fee, that if $100 from that fee could go towards scholarships for midwives of color or aspiring student midwives of color.
$100.
Yes, but if right, pittance. But let me tell you, the votes were drastically, it was like 180 to 120, and those 120 were very against it. They did not want their money going, and boldly stood up and said, I do not want my money going to this. And so my thing was, you're not paying an additional $100, and $100 is very little. It's already coming out of what you're already paying. But these people showed their faces, but anyway, it was 180 to 120, it went through. Do you know what they ended up doing with that money? They just decided a couple months ago, and everyone's been in an uproar, because people have been arguing that there is no place for Black midwives or student midwives in ACNM. They feel very much left out, even with the Midwives of Color Committee. So guess where the funds went? You can use those funds if you apply for a scholarship to pay your membership to ACNM. What? They can't use it for books. They can't use it for paying off some of their,
the organization.
it goes right back to the organization where they feel like they're not being represented. So it's like, congratulations, you played yourself, you know, thank you. So that opened my eyes to knowing that we don't always have to be, some institutions are set up not for us to thrive and they don't want us there. And yes, some we need to infiltrate and some we just need to remove ourselves from. That's my opinion.
Correct.
And that comment speaks to what I've been saying.
Yes, Dr. Brad, yes. I want to move on to the next attribute because we've got to move. The next attribute is silence. Now, Dr. Martin Luther King said, you know, it's important to watch who's not saying anything in the room, just as important as it is to watch who is saying something in the room. Silence to me is just as deafening and just as detrimental as someone who comes out and opens their mouth. And white silence is fucking brutal. White silence is just no joke. Black silence. Let's talk about that. Birth room, black silence. You turn your head, you see something, but you know. Now, Dr. Brad, I know I've been on this physicians group, and these Black doctors come together in a safe space, and every single one of them can point out every instance of racism in that labor and delivery room, at that nurse's station, on the floor, and the staff meeting. Every single one of them can point out the time, what was worn, what was said. Every one of them can point out an instance of racism, but they do not open their mouths. They remain silent because they don't want to make any waves. They have a career. They have to pay off all this med school money. What is happening when it comes to silence and Black birth? Panelists?
Silence is sound. With that said, it's when you talk about the physician and the midwife and the doula and all that, it speaks to being paralyzed. Your voice. You're making a calculated judgment of whether I should say something or not. But where I stand, which has probably gotten me into some interesting scenarios, is I come to it with an astuteness, with science, facts. I don't get provoked, very balanced in my presentation, and I call stuff out often. And with that, it engenders respect. So things that are kind of gray, I'll highlight the grayness of it. I'll say, in fairness, this could be perceived a certain way, but things that are black and white, I'm able to come to that confidently. And some of that may come from me being in this in this arena for a long time, and seeing that unless there is a voice, then the person who's looking at a situation is not going to even appreciate that they even did anything that was racist or not. So you end up educating people, and you got to take the hit for that. But if you come there as your best self, then you don't have to be silent.
Yes and no, Dr. Brad, because to be honest with you, I am fucking tired of educating white people on racism. I'm tired of being the one that calls it out every time. I'm tired of offering them solutions. I'm tired of holding their hand when they burst into tears when I call them out on their racism. I'm tired of being the one. I don't.
But let me say one thing.
Black people to keep educating.
Let me say one thing. Let me say one thing. I had a mom the other day, well-informed, 41 years old, knowledgeable. There was an encounter in her room by a nurse, white nurse, and this mom was African-American. This mom coughed once. White nurse got all frantic. Oh my God, you may have coronavirus. Have you been out of the country? And this and that. Mom was like, you're stepping over your boundaries. You're projecting onto me. I've been in the hospital for 3 weeks, and taught the nurse something, got the nurse's supervisor, didn't want the nurse interacting with her anymore, and said, I am at a place in my existence where I'm not being silent either. So I didn't have to say anything. I didn't have to elevate her awareness. The patient did at the ground level. She called it out, but she felt comfortable calling it out because I was her provider.
Right, you save space for her. Right, and you're just what we have to understand in this Black birth work, just our presence alone. We don't have to say or do much. We don't have to come in with the magic bag of tricks or the magic wand. Sometimes just there, you're coming there because you're not by yourself. You're coming with your ancestors and you're coming with all kinds of spiritual good shit. So sometimes just being there is very important. So thank you, Dr. Brad, for that. I want to move on to the next topic because this one, I know from looking at the comments that a lot of y'all are wondering. Jesse, the next topic here, the next attribute is savior. And from the tone of the comments, it is, what are you doing here, girl? What are you doing here?
Yes, thank you, Denise.
What are you doing here?
What am I doing here? So this is a question I've asked myself because, this acknowledgement of really understanding, what can I do to save the day? I think it's, frankly, it's also a doula. It's a doula attribute is what can I do to save the day in the birth room? So I really have had to deconstruct that for myself, is to say, well, what is it in me that comes into that play in terms of this conversation? It's the same one that I feel like I came to in terms of the birth room as well, is that it's not my job to save anything but space. It's my job to create space where voice can come through. So if I can, knowing the space that I hold, if I can create space to welcome in the Black voice, welcome in the BIPOC voice, that it's, that I'm gonna mess up on occasion, I'm gonna mess up and continue to pursue and continue to hold space in that way and listen as well. And I like what you said, it's not in terms of you're feeling the exasperation of having to educate white people on racism and educate people on what's occurring for you. And I think about that in just the small ways in my community, and finding ways in which I can partner so that, for example, my Black colleague, one small experience we had was we had a beautification project on our unit, and the beautification project were these giant pictures on the walls, and they were all white women in lacy gowns on mountaintops, pregnant. and didn't represent anybody really in our practice. And so my first response was to call everyone, including my colleague, and say, well, what do you feel about this? And to stand with her. So we decided to go together and have a conversation with the management and say, what's going on here? This doesn't represent anybody. And they immediately pulled those off the wall. And I know then there's a whole nother layer about addressing how that even got through a committee to do that. So I feel like, I just took a trip to Zambia, for example, and the friend that I traveled with, his sister is a medical provider there. And I asked her, what would you like me to bring? And she said, medical supplies. And it was a moment where I faced that also personally. Like, is this a moment where the affluence and the white savior component comes in, or is this a friend asking a friend for something that they need? So this is, so I invite that feedback as well. This is a moment when I really invite the feedback, because the only place I feel like the best place for me to direct my own energy is towards the white spaces that exist within my realm of capacity of influence, to start to deconstruct that, or at least start asking powerful questions.
Jessie, what people see of you first is your whiteness. They don't see that you're a friend, an ally. They don't see that you're even a doula. With me, it's a whole different view of what they see first. And that would predicate on whether or not I get through the door or not. If someone feels generous or someone feels benevolent enough to allow that to happen. So
yes.
When it comes to saviorism, when it comes to Black birth, the rest of the panel, do you have any feelings or views or experiences when it comes to savior in Black birth? Anyone?
I would caution us as birth workers of color to understand that we are not immune to the savior complex. With all of the rhetoric that is now coming forth, it's a kind of an increasing concern because, okay, the maternal mortality is up, all of these things are happening, which is fascinating because this has always been, but now we have a lot of push behind it. That so many of birth workers are coming into it with their pre-existing trauma. Then you add to that doing the actual birth work and some of the trauma that can be introduced in the experiences. And so I'm noticing, and it's not just me, because this is a topic of CNN's, we've had this conversation across the country, that there's a greater degree of animosity even towards midwives of color who are trying to do the best. Because now the other birth workers have to save them even from us who are trying to help. And so what we're seeing as well is some negative shifts that are happening up between providers of color and birth workers of color. And it's like, oh my, in some cases when you have a really severe condition, okay, her blood pressure was 140s over 110s, spilling protein, we're 41 weeks. Sweetheart, we need to, let's talk about getting this baby out. No, I have to check in first. I have to check with my dude. And I'm like, okay, those things are happening because we have to save birth. So just to check ourselves as well. It comes from both ways. And what are we doing to address our trauma as we enter the birth realm and continue to work in it? Just food for thought.
Yes, Pandora, and that is absolutely friggin' brilliant because that's what's called transference. And what I spend a lot of time as, I guess you can consider me a doula leader. I mentor doula, everybody. At that point, I guess, I'm saying to a lot of doulas, this is not about you. This is, we have to stay focused on the birth giver, the person laboring. And unfortunately, that's what happens. Where, you have to pull people back and say, hey, wait a minute, it's not about you. What a lot of people don't know, and I'll share with all of you, I had a traumatic birth with my son 29 years ago. I gave birth on Medicaid using PCAP. And my birth was so traumatic with him that I had 4 subsequent miscarriages after him. I have not been able to hold a full-term pregnancy ever since. So do you know that? No. Am I screaming it off of the rooftops? No. I don't divulge, I don't disclose because it's not about me. And as it was said earlier with the panelists here today, that self-healing has to happen in order for you to be more effective. You have to do that in order to step into Black birth. So I find that to be very, very powerful. Does anybody else have anything else to say? Because I'd like to move on to the next attribute.
I did, and it just went in one out the other. Oh, I know what I was gonna say. That for me personally, it's the call and response that's very important, because I do agree with what Pandora said. Anybody can be guilty of the savior complex. Oh, I know exactly what this community needs. I know exactly what this birthing, person needs. I know exactly what she should put in her birth plan. I'll be whoever their provider, or they put together a birth plan for me. I'm like, what? How can she put together your plan? Like, we're not listening to women and we're silencing. So it is, yes, we have to do our own healing work, but it's also throat chakra. We even had the exercise of throat chakra. So back to the other S of silence. Yeah, we're silent sometimes because we were hung for speaking, right? And there is still sometimes that proverbial noose around the neck that, stops you. You want to say something and you're like, oh, I don't want to say anything because I don't want to be publicly lynched, where people are going to say, oh, you're speaking up, you're saying this. So we are fearful and we don't. But the call and response is important. Put it out there, find out what your community needs, and then ask them, how can you best serve them, as opposed to, let's provide a program, this is what's going to help you guys. And then the community is saying, that was a waste of money and time, because that's not what we want. So we have to listen. As much as we, speak, we have to listen too.
Nubia. The next attribute is strength. Now, we've heard several sayings when it comes to Black life, okay? When it comes to, she's a strong Black woman. The strong Black woman on the plantation was the mammy. She was, and if you need an example, close your eyes and picture Gone with the Wind. She was the one who was verbal and was allowed that little room to be strong. That strength still had a rope on it. When it got too out of control, they yanked it back so that you couldn't get too far on that. So when it comes to strength, is this coming up between male and female when it comes to Blackness? Because I find that in strength, a lot of times the Black man gets more of a pass and the Black woman gets hyper criticism. She gets pulled back, stay back, be quiet. The Black man, and Dr. Brad, now you've done some radical things when it comes to breech births and stuff. Your strength and your tenacity in order to do this work has been applauded. I'm not sure, if the Black woman came forward and did that as assertively, would she have been hyper-criticized or even restrained a little bit? So let's talk about strength, panelists, when it comes to Black birth.
If I can make a brief comment, it's also vilified too. Like, how can someone be courageous enough to do that? They must be doing something wrong. Because from the observer's position, it highlights their weakness, and therefore, let me tear down what I see as a strength and vilify that. So I've been through that circus, if you will, time and time again. So from positions, people try to tear down those who have strength. I think, not to speak for women, but I think the same applies when they see a woman of color, that they're saying, well, let me vilify that. Well, whatever, it's too strong, angry, because their insecurities make them want to do that. So it's an interesting psychosocial dynamic that I think in that strength, and I think we've all been in arenas, everyone on this conference call, who's had to dance a whole lot in different environments and try to read the room, if you will. So that dynamic is really probably a lot to talk.
Uh-oh. I think we lost Dr. Brad for a minute. I think you're back on mute, Dr. Brad. I don't know if you realize it. I think it jumps and does that automatically. I don't understand that configuration, but we just missed the last part of what you said. I'm sorry.
No problem. But nothing else to say.
All right, so anybody else on the panel as far as when it comes to strength for Black women, for women of color, for the mom who comes in and says, you know, this is the type of birth I want to have, that strength. How is that working when it comes to Black birth? Is it working? Is it working for that doula? Is it working for that midwife? Is it working for that Black OB? Is strength working in Black birth?
I think it is working. I worked with Dr. Leslie Farrington and Shafia Monroe. We put together a curriculum for a campaign called ACT, and ACT is an acronym, and it stands for Ask Questions Until You Understand the Answers, Claim Your Space, Trust Your Body, and Tell Your Story. And it's a series of workshops, but also role plays so that people can practice, like when the provider might say something to you like, oh, your due date's coming up, so I'm going to strip your membranes, or like how to have that conversation, and providing them with factual information so that they can ask questions, so that if they do want to consent to something, they're consenting because they have a full understanding of the risks and benefits of what they're about to consent to. So I do see people coming in. I want to say yes, strong,
wait, what a cake.
but also just
Oh, it's in the middle. There's too much whipped cream.
But
okay, I see the cake. Where's the strawberry?
Jasmine, I need you to mute yourself, please. Anybody who's not on the panel, please mute yourselves and enjoy this thorough conversation. But when you don't mute yourselves, you're interrupting the flow. Nubia, keep going, my love, if you had something else to say.
Yeah, sorry, I was just saying that I don't know if I would call it, yeah, strength, but I would just call it more like informed and educated, which I think scares some providers even more. So for example, I tell, you know, my clients, like when I'm doing doula work, that if they tell you, oh, you're 4 centimeters, you want to know, well, okay, I'm 4 centimeters dilated, but how effaced am I? What station? So when I hear my clients say, oh, well, okay, I'm 7 centimeters. Well, what station? All the providers are like, whoa, like, how does she even know to ask that? So I don't know if it's being looked at as, oh, she's being too strong, but that she's informed, and this is somebody that we can't just pull the rug out from under. She's going to ask questions, and not because she's trying to be combative, but because she really wants to know, to be able to make a decision that's best for her and her baby. But historically, we are extremely strong, but maybe not always as vocal. So we're starting to vocalize more, but we know that historically we're strong, because to endure all the things that we endured and still be here in existence means that we definitely have an incredible amount of strength, but we internalize a lot of that, and it translates to stress. And that impacts our births because we have different allostatic loads of stress that we're walking around with. And while everybody's might be about the same, how that then transfers to impact on baby is different. So
stress
looks different and strength looks different depending on your background. For example, a stressor for somebody might be that the daycare closed that day. For one person, that might be, okay, well, I'll just call the nanny and she can now watch my kid. For somebody else, it's, okay, now there's no daycare. I can't go to my second job. I'm head of household. If I don't go to the second job, I can't pay my bills. So all of that stress, when we look at the graphs, it shows that even though we all might have the same levels of stress, the stressors that Black women deal with are our allostatic load, and how that corresponds to birth outcomes is drastically different. So that is also driving up our maternal mortality. So that be strong without any healing is not going to work in the long run. It's not sustainable. But speaking for what we need is, because that is part of healing, when you speak up for yourself.
Thank you, Nubia. And if anybody remembers Dr. Cornel West, one of his favorite phrases he says to all Black people, stay strong. And what Nubia is saying is true. If you have not done the inner self work, then that strength can be misdirected. It can turn in and manifest to stressors and anxiety and even depression. So that's very, very important when it comes to strength. The next one here is stagnation. Does any of the panelists feel that the whole issues, all the things in Black birth have kind of become stagnant? Do you feel like there's any progression? Do you feel that the momentum is still continuing? Or do you feel that we're kind of like, okay, we'll give Black birth this, and this is where we are?
I just feel like, yeah, I just feel like we're stagnant in the numbers. I'm looking at the numbers, and Black women are dying 3 to 4 times more. Black women are dying 5. Okay, we know that. We're stagnant in the solutions for it. Like if I get invited to one more screening of death by delivery, I mean, yes, I'm just saying, okay, we know, yes, but now what are we gonna do? Because when you keep on with the narrative of Black women are dying, that invokes fear in people, and it's, oh, well, then I'm not going to have a baby. And I'm like, oh, well, guess what? We're right back to what they wanted, for us not to procreate. So, okay, they're winning, fine. So it can't just be that. That's what frustrates me, when there's so many conversations about the numbers and let's look at this chart and let's do the statistics and all that. You're not listening to women when you're doing that. You're just looking at paper and black and white, but you're also not putting forth something for a solution. And we're talking about people living or dying. Like, we're not talking about, somebody choosing, I don't know, apples or oranges. We're talking about life. So that stagnation really frustrates me, because I feel like sometimes we're all preaching to the choir. We're at the same, tables. We're talking the same thing over and over again. So I'm grateful when there are spaces like this where we are breaking down and dissecting what the issues are, and then collectively trying to see what can we do to now surpass that. That is important to me.
Okay, anybody else? We have, I have about a couple more attributes to get through, but I want your responses, and I ask that if you can brief it a little bit more, that would be great. Does anyone else have anything to say about stagnation when it comes to Black birth?
This is Jessie. So what my one comment that I see as I'm doing this work is, it's the overwhelm where I hear, and I'm speaking directly to my white colleagues and the white people that I am working to enroll, and they'll say, oh, that's a really good issue, but now we have coronavirus, or now we have this, or now we have that. So even though they care, there's not a movement from caring, or even that idea of allyship to taking action. And they'll point to all these other, big things that are happening, whatever the topic of the moment is. Whereas I feel like this is fundamental in our birth work. So that's my comment at this point, is how to stay resilient in the conversations.
Thank you. The other attribute that's coming through here is skills. And one thing that I've learned in grad school as a medical social worker is knowledge, value, skills. And that's what I teach doulas all the time: knowledge, value, skills. What skills, how does skills strengthen or become a hindrance in Black birth work? Skills. Now, and I've done podcasts on this where you've got doulas that are taking every single training under the sun, and meanwhile, they've only done 5 births. Okay. You can't do that because here I am, I'm very honest, 148 births. I saw my first placental abruption at birth number 148. You're not going to see every dynamic that could happen in birth in 10 births, in 20 births, even 50. As I talked with a good friend of mine, Michelle, by the time I hit 100 births, that's when shit really started to click, where my aura, where my cognition, where everything was like, birth. It takes time. So panelists, please talk about skills when it comes to Black birth work, please.
Well, just in terms of midwifery, oh, go ahead, Dr. Bragg, go ahead.
Ms. Martin, you can go ahead.
Thank you. I was just going to say, in terms of midwifery, I feel like always honing the hand skills is very important. I think, like much of everything in our society, we're turning to more, tech and virtual reality for things. And I feel like this does drive up the complications. And instead of actually sitting with somebody or interacting with our clients, we're looking at a big screen in the nursing station of what the heart rate's doing in 10 different rooms. And then, making decisions based on that. We're not using our hand skills to determine a baby. We're turning the sono for everything. You have to be with somebody. So I feel like those hand skills are really important. Breech births, twins, all of these things that are becoming lost skills because we're so reliant on, well, what does the strip say? What does the this say? What is the woman saying? what is her body language doing? I see a lot of people who are like, oh, I'll switch to home birth, now, and they think that home birth is bringing hospital care to somebody's home. That is not the same thing. So you need to constantly, in this work, it's a constant learning process. I can never sit here and everything there is for it. I'm reading something every day. I'm reviewing things every day. And, I believe, yes, there's something to the experiences. You can't, of course, learn everything in 5 births, 10 births, 15 births. There is something being said for experience and also, quality over quantity. So it's a balance. But I do think it is important that people realize that you're not going to see everything and there's always something more to learn. And that is the biggest skill, that understanding that in this work is continuous.
Thank you. Anybody else with a brief comment about skills before we move on?
I'll make 2 brief comments. One regarding skill, it's where I try to impart the guided discovery to people, be it mother, be it the provider. You're going to discover things that you may have read about 20 years ago or last week, and now you say, maybe I should apply this. So, and it works both ways. So guided discovery helps you. I mean, I've given breech workshops where there's like standing room only. I mean, truly, like, you can't get in the door, but who's going to do the breech birth? So it's nice to go to the workshop, but guess what? When you have a surprise breech, you gotta kind of do it. So that's the thing with that, with skills. I want to back up to the stagnation question. I have a thing called a B score, where it ranks 9 things, such that the mother can say, if there's alignment in these 9 areas with my provider, my situation, then I'm going to move the needle with how I'm going to have an empowering experience and thereby not be a victim of the mortality rates, not be another statistics, et cetera, et cetera. So if you apply a B score to your situation, to your provider and yourself, then you can see if there is alignment. And those 9 questions consist of very low ball things like, is there going to be active listening? If there's a medical complication, how is that managed? Do you believe in birth options? Do you believe in childbirth educators and doulas? Will you treat me respectfully? Do you believe in VBAC? Is ACOG recommendations? If the person says no, then it says a lot about their style of practice. So if you apply a B score to your situation, there needs to be a 90% concordance, and there's only 9 questions, 10 points each. If you're at 30%, then there's work to be done on both sides. So you're going to, if you can get it up to 90%, you're going to have more trust in each other. You're going to want to speak up. You're going to maintain your voice. You're not going to be afraid to raise your hand and become another statistic. So you got to apply a B score to situations. And as far as skills, a lot of it is guided discovery. There are oftentimes people ready for breach all day long, and it's a different kind of, how are you handling that? So that's it.
I'm going to follow up with you about that B score thing, because that sounds very powerful, and I could definitely see myself doing that. The last couple of attributes that I want everyone just to jump in, because we got to wrap it up a little bit for time here. The attribute of C. What do you see in a birth? The attribute of self. What are you yourself bringing into the dynamic of Black birth work? And last but not least, salvation. Can we truly, truly turn around the dynamic of Black birth in America? Okay. C, self, salvation. Panelists, take it over. We got to wrap it up.
I'm sorry, did you say the first one was C? Like
See, you know,
C.
Africa,
Okay.
I see you. What do you see in this in Black
Yes.
Birth? What are you seeing? What are you seeing? Make it brief
Right.
because we got to wrap it up. We got 2 other attributes to cover.
Sure. So in terms of what I'm seeing, I see a lot of potential. I see a lot of dedicated individuals who are looking to see where they can get in, where they fit in, and help turn this thing around. I also see with my mind's eye that if this was turned around, if the numbers were reversed and it was white women dying, there would be instant action. This would not be a matter of, well, there's other issues that we need to address. I see that for sure. Myself, I continue to do the work every day and collaborate. And then in terms of salvation, I feel like when we do the healing work, yes, there's a chance for that. And when we address the real root issues of why we're having these complications. So we know that most of the complications besides heart issues are related to operative birth. We need doulas in all settings because we know that's going to lower the risk of a C-section by up to 50%. That is crucial. And we have to also have more postpartum care for sure, because if somebody has an operative birth and is not seeing a provider for a while, they are in a risky state. So I'll leave it brief so everybody else can chime in, but I feel hopeful and I do see a solution.
Thank you, Nubia. Thank you. Anyone else? See self-salvation in the Black Birth. What do you see? What you're bringing in yourself? And the salvation of this whole paradigm of Black birth work. Is it going to turn around?
I'll make a comment briefly. I see providing tools so that a mother can have tools in her toolkit. I mentioned the B score, which means bring birth back, by the way. So the B score helps as a tool to guide the provider and themselves so that everyone is clear about their preferences. I also see the model of shared decision-making, shared responsibility, and guided discovery, changing that mortality rate. Because to let it happen to you as a victim, without you having your voice to say, hold up, my chest is hurting, I need help, then as long as we play that silent role, then the mortality rates will continue to rise. Because why will they want to take care of you unless your voice is maintained? So that's important. As far as the salvation of where this was going to go, I truly believe taking it back, putting the decision-making into the hands of the mother, putting the power back in her hands so she is comfortable having her voice is going to make the providers better. You believe it or not, you can have a white doula who doesn't have a cultural connection with you. But if you are aligned, it's okay. You're both humans. So you don't necessarily need all Black on Black and white on white and white disparaging Black. You need the alignment to be established. And that comes from maintaining your voice and saying to someone who is from Ireland, you know what, appreciate that, but this is how we do it over here. And you both can grow. I mean, I had a doula consortium in my practice. I used to pay doulas to be at every birth. White, Black, Asian, didn't matter. Even had a male doula in there, by the way. But they were connected to the humanity of the birth. And it didn't matter about the ethnicity and the color. I agree there's cultural sensitivities and things like that you don't have to bridge that gap. But if the preferences were understood, then the connection and the alignment could be made. And then you would have less mortality and morbidity by people being able to speak.
Thank you. Thank you. And I just, anyone else before we wrap it up?
What I would like to see is that we also shift the conversations a little bit, because I fear that with another S that we haven't talked about, the sensationalization of all of this that has happened recently, we're shifting the picture and we're not looking at all of the near misses that are happening, the longevity of it. I see that we need to have more hard, ugly conversations that aren't going to fit into a nice little every meeting should be 1 hour package. You know, in order to really, we're going to have to dig deep within ourselves, because if that doesn't happen, we're not going to get to where we need to be. And looking at this again from a life course perspective. you know, from our wee girls to our grandmothers, that we have to be addressing this issue, this reproductive life course issue. It's not just a mortality issue, from all aspects of our community, bringing everyone into these more than conversations, but to do the hard work.
Yes.
And bringing ourselves, yes, but in that we have to take care of ourselves, because again, the growing concern of the number of sick midwives of my generation who are 20 plus years in, they're dying at such a horrific rate with so many, and this accounts for all birth workers, our self-care, our relationships, our family as well, because when we're giving so much out and not pouring back in and just being kind to each other. Can we stop all this infighting? You know, and all these factions that are in there?
Thank you so much, Pandora. Thank you to everyone who participated today. These 2 hours really flew by. I'm really surprised. I thought it was going to drag and lag, but it really was amazing. The attributes that I used today, that I was spiritually guided, Shango came to me and said, hey, honor me. So it's slavery, safety, service, selection, silence, savior, strength, stagnation, skills, see, self, and salvation. So those are all the attributes that I picked up today to talk about Black birth. I want to thank all of my panelists for coming on here today and having some really frank and open discussions, as well as to really do some very, very nice transparency, which was absolutely wonderful. I would also like to give thanks and praise to the National Black Doulas Association for allowing me to facilitate this event today. It's an honor and a privilege to be in your company and to contribute to this organization, which I have a lot of loyalty to, and I really do hope that it lasts for generations to come. This is something that is a wonderful, wonderful opportunity for us to contribute and to build and expound on. So thank you all so very, very much. Jessie, thank you so much. Nubia, you're my girl, you're my girl. Thank you. Dr. Brad, I'm still your